Hey everyone, welcome back to Agenda Now. Today, I'm breaking down what really went down at a recent congressional hearing, the kind of meeting that could actually shape your next doctor's bill. The focus? Soaring healthcare costs. And at the center of it all, Senator Mike Crapo, making some big promises to finally tackle those rising premium rates. Let's set the scene. The hearing kicked off with high stakes. Americans everywhere are feeling the squeeze of expensive premiums, and Congress knows it. But instead of the usual political grandstanding, things took a different turn. The committee chair, after hours of debate, decided not to drag things out with a long speech. That's rare in Congress. Instead, he thanked the witnesses, doctors, policy experts, real people, for sharing their stories and solutions. It set a different vibe, almost like, hey, let's actually listen for once. But don't get me wrong, this wasn't all handshakes and smiles. There were real clashes. Senators argued over how to fix things. Some said government needs to step in more. Others pushed for market solutions. You could feel the tension, especially when they brought up the latest round of premium hikes. Still, here's where it gets interesting. Despite all those heated moments, the witnesses managed to get both sides talking about real, actionable ideas. Stuff like making prescription drugs cheaper, improving transparency, so you actually know what you're paying for, and cutting out waste that drives costs up. Suddenly, it wasn't just a shouting match. There was actual agreement, at least on the need to do something, and fast. Senator Crapo, in particular, made it clear he's committed to finding ways to make healthcare affordable for everyone. He talked about protecting families from premium spikes and working with both parties, no matter how tough the road gets. As the hearing wrapped up, the chair hammered home one last point. Congress can't afford to sit on the sidelines. Americans need relief from these crushing bills, and this committee is determined to deliver. So, what's next? The path is still bumpy, and there's no magic fix. But for maybe the first time in a while, it looked like lawmakers were ready to roll up their sleeves. Together. If you found this breakdown helpful and want more straight-to-the-point political updates, hit that like button, subscribe, and turn on notifications so you never miss a thing. Thanks for watching Agenda Now. See you next time.
Very much, and that does wrap up the questions. And Senator Wyden has given his closing remarks. I will forego my lengthy closing remarks and simply say to our witnesses, we thank you for coming. We thank you most of all for the information and ideas that you have presented to us. Those who have listened to this whole hearing will have seen a lot of argument about things where we disagree. They will also, I think, have seen a lot of suggestions and proposals which our witnesses indicated had discussion with us on, where maybe there is some bipartisan progress that can be made to make health care more affordable. I agree with what Senator Warnock said. He's all in, and I think everybody on this committee is all in for trying to work together to find those bipartisan solutions to make health care affordable and protect people from this explosive impact that the unchangingly high increases in premiums is pushing onto them. And with that, again, thank you for being here to our witnesses, and this hearing is adjourned.